Hello, everyone, and welcome to BrainX Talks. I'm Piyush Mathur, and I come to you from Cleveland, Ohio. This is another fantastic episode of BrainX Talks, and we hope to make this a podcast about conversations with leading figures and their work at the crossroads of artificial intelligence and healthcare. Let me introduce myself quickly. I'm an anesthesiologist, intensivist, AI researcher, practitioner, co founder of BrainX and BrainX Community. In today's episode, we will take the opportunity to know Dr. Kamal Maheshwari, his exciting journey, experiences, and vision for the future for artificial intelligence in healthcare. Dr. Maheshwari is a distinguished anesthesiologist experienced in clinical practice, research, and innovation. He completed his training and medical school in India and then came to work at Cleveland Clinic between 2009 and 2023. He has earned a Master's of Public Health from Johns Hopkins, Bloomberg School of Public Health, and also a certificate in quality patient safety and outcomes research from the same institution. Dr. Maheshwari in 2016 went on to found Center of Perioperative Intelligence at the Cleveland Clinic Foundation. And he also coined the term perioperative intelligence, focusing on artificial intelligence applications in perioperative medicine. His research portfolio includes over 100 peer reviewed papers, book chapters published in leading academic journals, primarily evaluating the role of advanced technologies, predictive algorithms, machine learning, artificial intelligence in developing decision support systems to enhance perioperative care and outcomes. Dr. Maheshwari, interestingly, is also the co-founder or co-founding partner of BrainX and BrainX Community, both of which are AI and healthcare companies based out of United States. Driven by a commitment to improving global health, Dr. Maheshwari founded Rouge Health recently, an organization dedicated to enhancing healthcare in developing countries. The primary mission of Rouge Health is to empower doctors and patients with high quality information for better healthcare decision making. So, welcome, Kamal.
Thank you, Piyush. Thanks for the kind introduction. I'm excited to be here and looking forward to the conversation today. You and I both know the importance of artificial intelligence in the coming future, and what I always wanted to do is to give a perspective and context that how actually is going to happen, because there's a lot of gap between myth and reality, and where it should happen. And those are the things which have guided me into my decision making, if you will, into what I need to do. And that's yeah, I'm looking forward to the talk today.
Thank you, Kamal. So, let's talk about your fantastic journey all the way from India to being a clinician researcher, then AI, and now starting a company called Rouge Health, which is a digital health and AI company.
Yeah, I don't know how amazing the journey is. It's a journey, and I'm enjoying the journey. So yeah, as you said, I grew up in India, did my schooling there. Uh, I, I I grew up in a small town. It's in if anybody knows India, I'm from Rajasthan. It's a small province, and came to Delhi uh, for studies in University of Delhi for medicine. And as a matter of fact, my family was a little reluctant sending me far away in Delhi. They were like, okay, no, you should stick around in our province and study medicine over there. And here we are. Um, studying in Delhi for um, did my MBBS and did anesthesia training, and uh, so the motivation, if you will, what is going on. So a lot of time we think that we have decided a lot of things on ourselves. Sometimes it happens, and a lot of things was just happening, right? uh, yes, I was a good student, and then being a doctor seems to be a reasonable choice. And there was a choice that should I go to which college, where to go, and I landed in the University of Delhi, right? So that happened. Uh, when you go to Delhi, there's a different world from a person like me who was from a small town otherwise. And that world opened up to even bigger world, if you know. And that when I was finishing up my medicine training, it seems like a lot of my colleagues and friends, they were going out of India, and I was like, "Whoa, that's far." A lot of people went to United Kingdom for advanced training, to Australia. A lot of people went to US for advanced training. I was initially not interested. I joined a job uh, in India for a few months, or not. If not, a few of my friends who were here, they kind of you know they I would not say pressured me, but they gave me a bunch of reasons to say that, for oh, you can get good training here, you do advanced training, and you can come back, and you can do good research and stuff like that. And that brought me to United States. We did my residency in University of Arkansas, and my first job I started in Cleveland Clinic. Um, and that was also uh, kind of very arbitrary. At the time when I'm finishing my residency, I was debating what should I do. Should I do advanced training and into cardiac anesthesia or critical care? Should I go into hardcore research? And I remember distinctly interviewing at uh, Johns Hopkins, Cleveland Clinic, and as I said, my friends have a lot of influence in my life. One of my friend was in Sacramento area, was like, "Oh, UC Davis, you should also look into it." And out of all the choices, I picked up Cleveland Clinic. Initially, I was just hoping to focus on clinical work. I love on the clinical science and taking care of the patient, and we'll figure it out. So that's how, out of the choices, chose Cleveland Clinic at that point of time. Um, the, During Cleveland Clinic, once you are getting into different areas of what you to do, it's a good culture in which they do want to guide you into one particular way. Okay, what you want to do in your life, um, that you want to focus in one particular area, that's the way to success and stuff like that. I was still not very clear what exactly I wanted to do in the first 1 or 2 years till I did my boards and everything, I guess. uh, and then uh, maybe one fine morning, or I don't know, it happened over a few weeks or so, I decided I want to do something different. Something different is something which is impactful. I don't, and that uh, word, I mean, it does comes at very lightly and very cliche kind of thing, that okay, uh, because I knew that I came so far. I'm doing uh, you're staying away from your family and everything, and you worked hard into during the residency and all the stuff, and now what you want to do is you don't want to kind of waste this thing, and you want to do it something purposeful and impactful. And I started looking into different areas which I wanted to work on, and it seems to be you know uh, impactful in a work, that your work impacts a large number of people. That's what how I thought about it. I started looking into different areas, doing management programs, again fellowships and stuff like that, and then started I mean, long story short, I started deciding to work on a public health program, and then joined Masters of Public Health in Johns Hopkins, and that gives me an idea that how the work which you do right on a daily basis, if it's deliberate and everything, it can impact a lot of lives, right? And not necessarily it has to be a large, you know big chunk. In a way, it could be incremental changes, but incremental change for a lot of people. There's uh, from every organization, every experience in our life, you learn something. One of the things which I learned from Hopkins was saving lives millions at a time, and somehow that stuck with me. That And that also gave me that, okay, how you do it, right? It is not a magic wand you're gonna wave to do this thing. And research seemed to be a good way to do it, because if you work on certain areas, you find something interesting, impactful, that can be used throughout the world in a way, right? So this is my way of saying that, okay, my impactful work will be research, right? You impact how, and the area which we are working on in anesthesia, how anesthesia will work, and how the outcomes of the patients get improved. And that's it seems like my interest in technology, that whatever the technology which is comes out to be. And it seems like in 2015-16 AI was just coming up, right? And people started talking a little bit about it. And um, and that was pretty early. And AI, it's just like, a simple computer is also AI in a way. But what anything which is not done by human brain, or by the computer, is basically a technology, which or artificial intelligence in a way. um, so in that way, it came out to be, okay, research is the path. And it seems like all the technologies, like predictive technology and everything, were just getting started on at that time. And to make sense of the whole thing, it was important that how does it finally impact, right? The impactful, like impacting the patient and patient lives and outcomes, right? So that's how everything came together for me, right? With all what I wanted to do, what I did over a period of time, and with my interest also, it came together, that, okay, well, this is my version of impactful work which I was doing.
No, that's fascinating, and it's interesting, like surrounding yourself with the best, inspiring you to carry on with this journey. That is so insightful. But as you go through this journey, I'm sure you faced a lot of challenges as you move from one thing to another, being a clinician, to thinking about research concepts, from research concepts to product development, and then now starting a company. So, what has been most challenging?
Yeah, challenges. Yeah, that's part of life right now. It's challenges everywhere. The problems are everywhere. I think is the perseverance to kind of see through, which keeps on improving every time you kind of keep working on it. I'll just give you an example. When I started working with the research, and maybe I've told the story to one of you guys, but uh, I I went to uh, my my previous boss in the research, and Dr. Dan Hessler, uh, that, okay, I'm interested in research, right? This is like early 2012ish, a long time back now, it seems like. And he's like, yeah, okay, we have some idea, we can talk about it. I had a very and my ideas was always like simple question, like why there's a variation, like for example, Piyush wants to do this way and I want to do this way, like which one is it right? And there's no easy answers in medicine. Like for something, like, okay, you give, if you have infection, you give antibiotic, and with a lot of things there's no major good answers with us. And I remember the first so-called protocol or proposal, which I have an idea scribbled down, to a formal proposal written to get into the IRB. It took 8 months for me, with back and forths, like, okay, this is how it is done. Obviously subsequent proposals were not taking that much of time, otherwise it will be very painful. uh, but whenever you start something new, it just takes time, and you just have to kind of put your head down. And obviously, being lucky and fortunate to be uh, to seek the guidance of the right people at the right time. I mean, I think that that's the key. Seeking guidance, so I'm repeating this thing, seeking guidance of the right people at the right time is number one. And number two is having a perseverance to follow it through. Because it's not only that you found somebody and has told us this can be done this way, that way, and you have some idea you want to do this way, right? Because you might just in 1 month get done with it, like, no, I cannot do this thing, right? You have to see it through. And that's what, you know multiple things which I've done in my life, I've learned uh, that those are the two essential components which comes into play. um, so Now the question is, which is more challenging, right? What is more challenging? So I submit to you, uh, challenge is pretty much everywhere, and I didn't see anything which is like straightforward, simple. It always comes down to that you just have your goals in front of you, uh, get the right people around you, and seek right guidance, and put your effort into it, right? Um, Now, out of all these things which I relevant to the discussion today, I know that we are talking about innovations and AI and all these different areas. Um, the I think we can divide things into ideas, right? Good ideas. So uh, I would say the number of ideas which are out there, there are plenty. People with good ideas are also plenty, right? And they're smart people who wants to do a lot of things and a lot of good ideas. And I didn't see any challenge in finding good ideas into my life, right? So the idea is not a major, you know, uh, major roadblock into any journey. The next is from ideas to execution, right? And which is a little challenging, right? Which is definitely more challenging, and in which getting right people into play and putting your effort into it, and follow it through. So idea to execution is challenging, but I think it's still doable. That's the next level which comes out to be, and that is always a much bigger challenge than the idea itself. And especially in the now I'm in the entrepreneurship world, if you will, the from academics to my recent jump. um, I learned a lot, and I learned a lot. And what I see into building company, or startup world, and there's a lot of excitement when you look from outside that this going to happen, a b and c. um, in that word, as I said, ideas are plenty. A lot of people are doing from idea to execution also, plenty, right? But the third component is basically, uh, which becomes another thing, how you make it sustainable. And that is even that's the biggest challenge which comes out to be. And sustainability come from two ways, right? What you build, people start using it, right? It because in research labs, idea to execution, you are done, right? Papers get published, products get built, algorithms you know get out, get their FDA approval, and so on and so forth, right? So you have something, the execution is done, you are out there. But in startup entrepreneurship world, now you have to say that how you going to make it sustainable, and those two ways, you generate revenue and people start using it. And that is the one of the most challenging thing. And it is basically, uh, obviously I'm learning, right? I'm not saying that I've learned every part of it. A lot of people maybe know about it, but even people who I've interacted in the last 2 3 years who know about this thing, is like I've seen people obviously struggle a lot in this field, like how to make things sustainable, how to find the right thing which people will use. And that means that people are really, they're seeing the value into it, and if they're seeing value into it, they're ready to pay for it, and there's a money to be made. And that's what it makes to be successful in that way, right? So yeah, I mean, I think that's how the challenges, gradation, if you will, is going to come out from my side.
Yeah, no, that's very interesting. I think if I can take one word away from this, it's perseverance. And I know you, who has always persisted and persevered to make sure whatever you thought of happens. So, really excited to hear directly from you that that's one word that drives everything with you. And you're talking about this company that you recently founded, which is a unique company. It's amazing because it has the potential to touch so many lives. It's already touching so many lives, and it's applying state of the art AI models for the personal health record. So, talk to us more about Rouge Healthcare. It's really exciting.
Yeah, so Rouge Health, was started. The idea was started, post, mid and post COVID era, I would say, and it was mostly when we, as all of us were trying to provide, help in different areas, right? Both in clinical sense in our hospitals when the COVID pandemic has happened, so much of things were unknown, even in developed countries like OECD countries. But in the developing countries, things were even, you know, unfathomable, right? Like what was going on. And it seemed to be no matter you, how much you can do, the total lack of information, especially I'm from India, obviously, and then when we're talking to people and we're trying to help over there, is that, people not having a basic health record for any person, right, regarding what needs to be done or not, is there. Uh, the, and this was compounded by my previous belief is that, we um, i in India, we know that even for my mom, we don't have a, she have some paper slips, even post her heart surgery, um, from one of the India's best hospital, in 2017. Everything is on paper at home, right? Whenever she goes to Dr. Kuforsi, she takes that bunch and then go over there. Um, so when I thought about, okay, if we want to do something, in India, what it should be. I was talking to my friends. One of my bunch of my friends were like, "Yeah, we should do something over there. Let's start brainstorming into some ideas." And finally, few of us. One of my friend is a critical care physician. Right now, he's in Singapore. I'm at Council. Um, uh, we we came together that, okay, I think the way to solve this thing would be at least first get a digital health record. Like first get some information digitized before you do some guidance or AI on top of it. I mean, there's you cannot do AI on paper records or guide them on paper records. Or even if you don't have a medical record, yes, I can submit that artificial intelligence can help, right? But then at least you people have to be on the platform, right? Interacting with some information, right? At the natural language level or whichever level to get them guidance, right? And so this is before GPT world, right? And so we started this thing, and our goal was to build a platform where people start getting information on board. And believe me or not, I mean, this is, as I said, this idea a lot of people have in India, right? They do think that this is a great idea that everybody should have a medical record. It should be, cell phone is ubiquitous, and it should be a mobile health based, like personal health record kind of thing. But execution point of view, not many people have done it, right? Which is a huge market. I don't know why. Uh, but the more I knew and looked into it, obviously we learned about it, right? uh, so the major component which comes down to of Rouge Health is that, okay, we want to empower people make the right decision, right? And for that empowerment we need medical records or some information about those individuals, so that you can guide them. um, we changed, after 1 year, to the empowering both doctors and patient, and to our mission. The reason it came out was simple, because the basic health awareness, even in the most educated, like the middle segment of India, um, is pretty low. And this is, I'm talking from my family and friends, well educated, even doctors, to the budding middle class which is there in India. They will talk about that they want to get healthy, but then that's pretty much it. And then we go back to whatever we need to, our non-healthy lifestyle. Plus, we blame everything on genetics, right? Um, so we said that, okay, the medium through which you can connect with the patients is through doctors. So if you empower doctors to create health records, and that is in communication with the patient, then that could be a meaning, that could be a platform, right? So the way that we end up doing this thing is that we built a platform to a digital health platform for the doctors in which uh, they can manage their practices. For example, a doctor, and you go from a very basic, right from the scratch. Don't think about Epic, what Epic does, and you replicate them from Epic to in India. You write from scratch. Scratch is that okay? You go to a doctor. It's like, what do you need? What do you think can be we can help you, and we can digitize that. And if digitization can help in that, and some answers was as simple as, hey, I just need to manage my OPD queue. I just need a queue management system, right? That's it. After that, I have my paper slip and I'm okay, good to go. Some go to the next level that, okay, I need just some help with appointment managements, right? Um, some goes to the level, oh, I do have all the documents of my patient. I scan them, and this is there on my server, right? So I need a document management system. Some goes to the next level, and now it's coming that some people have started writing prescriptions, electronic, right? And so and so forth. This is a building block kind of thing. So we talk to the doctors and we say, okay, what do you need, and what do you need to take care of your daily medical practice, right? And that's what we built a solution for them. It's a web-based solution, and now any small hospital or a doctor's clinic can run end to end on that system, including e-prescriptions to whatever their billing requirements are and basic stuff, right? Then we said, okay, now this, how does it interact with the patient, the system, right? So now the patients who used to get some paper slips only now can get all this information on electronic format in their mobile app through their personal health record, right? We told the doctors that, okay, your patients can have a free personal health record app, right? Whatever you do, whatever you see here, it's a cloud-based system. Whatever you see here, your patients can see, and whatever patient enter, for example, a patient enters a blood glucose value or a blood pressure value in their mobile app, right? That you can see on this platform. So it's an interactive platform. You can do messaging, right? You can send reminders to your patient for health checkups and other things which needs to be done. So it becomes an end-to-end platform, which is a mobile-based personal health record for the patients, and now for the doctors to run their whole practice. Now, on top of it, the one thing which I want to add here is that many times, especially in the health care, uh, you have to get some tailwinds from the policy perspective. And at this point of time, at least in India, this is the right time, because in India, Indian government is going through a big infrastructure push to create a digital health uh, economy, if you will. What does that mean? Now, if you have, for the uninitiated who don't know much about India, if in India, for the financial transaction point of view, if you think about it, 50 to 60% or more of the financial transactions happen through the India's own ecosystem, which is based on Aadhaar, or it's a digital payment system called Unified Payment Interface (UPI). I mean, if you go to India and if you have a credit card, you might have difficulty in using that credit card because most of the payments happen in India through this QR code based UPI system. And it's so frictionless and free of fees and everything. Even other countries are trying to adopt it, and it's a big, issue or risk to multiple Mastercard and Visa, credit card companies. So it's a total game changer. It's a game changer into how the finance work. The same ministry people, same architects of this system, are have created in the Indian health ecosystem, with every person will get a digital health ID. It's called the ABA ID, and the government who will be the um, finally giving the infrastructure to the people, and all the records and everything will be centralized in certain way, right? And it's not that the government will have all your data. It will be they will be having the keys that, for example, person A or Kamal Maheshwari have his record located in hospital A and hospital B and hospital C, and hospital B can download the record from hospital A through a consent based management system, rather than having faxes or emails, which happens in the United States in the most developed countries. So that's the concept here. And this was launched 1.5 years back. Um, and this will change how the healthcare is delivered, and it could be a benchmark how things can happen. Now, India is a complex country. A lot of initiative people have talked about comes and goes, but this is a priority from the government. But also, it is a technically solvable problem. So technocrats are running this thing, so the chances of success is higher. So now coming back to the Rouge Health, how does it impact us now to create any health record, right? A unified identifier is needed. Data security consent forms are needed. So we got certified as a vendor from Government of India that, okay, we'll be your vendor also. So we participated in that, and so being at the right time at the right place. Now our company, Rouge Health, is also one of the certifiers to make any hospital, clinic, doctor, insurance company being in compliant with the government infrastructure, which is called the ABDM compliance, right? So that's the tailwind which of the digitization which is happening in India in healthcare, which is pretty minuscule, um, eh, and that is hopefully going to help, right? Not only to the success, right, but also to the fact that this is what I wanted to do, right? And, we want to impact a lot of lives. We want everybody to have their health records. We want doctors to have their all the information on the computer digitized, so that when the patient comes back, they have something to go back to, which is accurate, and like not in a scribble of piece of paper, or everything is from the memory. um, so I mean, that's what we are trying to do in India. We are saying that we are helping create the digital health infrastructure. Forget about what's going to happen on top of it once this baseline setup is done, right? Then you come into the decision support systems, which are rule based or not, right? Then AI, which comes on top of it, right? Because the context matters, right? No matter, I mean, at least one thing which I've learned, I'm not an AI engineer, but as a clinician and researcher, when I've learned, context matters. Like if you don't have context information, you will not be able to validate your responses. You will not be able to create your responses. Hallucinations will be there, and it's hard to get rid of them. And in healthcare, where error is not like you're going to lose $5 or $10 or something, which can affect your life. You cannot be betting against the fact that you want full you want high quality AI system which are validated. It cannot be uh, just just the fact that, okay, it works, that see it works. And even in the last 5 6 months, Piyush, the work we have done, how much even in the best of the AI models, we have seen wrong information just coming up once you look closely, and it seemingly look so real. It's so deceptive. It seemingly looks so real. It will create a paper or citations to everything which is seemingly so real, and it's totally wrong. And that is the one of the scary part of this thing is. And to that extent, what I'm saying is basically, especially in the healthcare, the more information about the context you provide, hopefully the accuracy will improve. So that's
No,
what's going on in Rouge Health. I know it's a big task. I mean, this is the biggest. Yes, I'm most scared about this challenge, if you in this way. But I think this is in the right direction. If one last thing I would say before I stop speaking on this thing is that uh, you know 80% or 85% of the world population lives in developing and underdeveloped world, right? Beyond 16 OECD countries, if you look into the data and everything, and healthcare is not as great, right? We at times complain about in the US the healthcare is well bad, but yes, that there are reason for wasteful healthcare and other things, but think about then you put the context into number of people, right? Around 8 9 billion people, right? 6 7 billion people living in developing world who don't have major healthcare, uh, or the quality of healthcare is not optimal, let me put it this way, right? And then digitization, like for billions of people, is not there, right? So if we are able to make a basic solution which help this large big chunk of population, right? Even small stuff, that's what my goal is, right? At this point of time, I totally understand. There's a different world also which I've lived in. I was a liver transplant anesthesiologist. I've worked on two very small segment of population, and that is equally needed, right? But at the same time, I feel that this is large number of people where you can even build a small solution is going to be impactful.
Yeah, no, you always think big, Kamal. And for those who don't know about Rouge Health, I would encourage you to Google and go to the website and check it out. And if you haven't downloaded the app, I have the app and I'm a consumer, so I do use the Rouge Health app. And I would encourage you to download it and check it out. And it has all these different features that's out there. So it's real. It's something that you can actually touch, feel. It's in your hands, and you can use it today. So that it might be scary to you, Kamal, but to a lot of us, it's very exciting. It's very exciting. The opportunity is very exciting, and thank you for leading this work. The other impressive thing is how you have approached it. So many companies have approached it from the billing side. Many companies have approached it from the data side. You approached it from the patient side. So it started with patients, then it went on to physicians and clinicians, and then how do you make a system wide change, or a nationwide change? So that's very impressive. So thank you for all your hard work and your team's hard work. We are very very excited about it. Well, let me go to the last and the next question. What excites you the most about future of AI in healthcare? You talked a little bit about implementing it. There are some challenges over there. What excites you the most?
So I'm totally excited. I think the biggest value of AI is going to come into in two different fields, right? Now, for one is defense, which is not for good from my perspective, because people gonna use AI a lot in defense technologies, right? uh, and the number two will be in healthcare, the biggest impact, right? So healthcare will be a positive impact. Defense, personally, I think people are going to ruin what hopefully it gets policed appropriately. uh, the reason I'm saying is that because if you look into other sectors between finance and everything, there was the amount of research, amount of data analytics and everything were there a lot. Like if there was decades of work which is already get to there, they're maximized, like from the trading and money point of view, people always maximize money related things. And in healthcare, I think the impact will be biggest, right? Because in healthcare, the information or the information which is there and the decision making is very complex, right? It is not simple rule based, uh, and so that's number one. Number two, in healthcare, as I told in the earlier part, the number of people who have access to good healthcare is also limited, right? So once you don't have access to uh, good physicians, good clinicians, good hospitals, right? Um, and the complexity of information, complexity of decision making is also there. I think that's where the AI will shine and will show the biggest impact. And as I said, we have to be cautious, right, regarding. So I'm not saying just as a footnote, but I'm seeing, because I'm seeing it, right, that we have to be cautious that how it's get utilized. And for to get it utilized, we have to kind of create a benchmark, right? A benchmark is that everybody have some similar information, right? There has to be information exchange. We have to give up something, right? It will not be totally private. Uh, you know, at some point of time, I should be able to share my information, so that that information, like what I did today, how's my, let's say, heart rate, to multiple other things, multi parameters thing, which is coming out to be on my medical records or my diet patterns and other everything, comes into play, right? To what happened to me, I had a flu or not, did took flu vaccines or not. So every piece of information will be useful when the AI will ultimately be able to guide me that what I should do for better healthcare. So that's where the AI, the value is. Number two is basically we do know that the healthcare is a very comparatively specialized field. Like when we say doctor, we are not saying a physician. We are talking about an endocrinologist and cardiothoracic anesthesiologist, right? So there's so much of complexity within the field of healthcare itself, uh, that our ability to serve to all the population, and create all these people on you know on the scale to serve all the population of billions of people around the world is not there. And I don't think we will have that infrastructure. But what we would have is basically AI based technology, AI based decision support systems, right? So yes, a person in my small town, back home in India, every person can have a primary care physician, which could be a AI supported primary care physician, right? Uh, so that is the if you do that, the improvement in quality of life and mortalities and all the stuff which comes going to come out to be, will be humongous, the value which comes out to be. So it is not at the level that we're going to save so many people from lung transplant. It's going to be coming at the level that, okay, a lot of people got primary health care, right? Like everybody got primary care healthcare, right? So it's not only few people got it. So if you do that, then the mortality benefits, or which you get out of the system, will be huge. And AI, I think, is the tool which going to help there. And there are a few people like who have already gone that route, taken that bet, and from I think Khosla Ventures have gone and said that okay, there'll be a PCP for every person, right, which should be available. But again, so that PCP is for the Western world, or it is one for a small town, you know, in India or South Africa, right? So those context information has to get in place, right, for that right PCP for that person to come into play. So it is not easy. So it seems like okay, I'm going to write a model that okay, because a QA model, which is I'm a physician, you can do. Can you answer a question? Yes, you can. Start everybody become a PCP, and it can be doable today. It is doable today. Uh, but the amount of hallucination which we are seeing it, right? We know that um, humans genetically are different. They live in a different environment, um, and it's just so much of differences which comes into play. So even the primary care physician, if the AI based, has to take into account everything to come in to make that happen. So yeah, so even if I started Rouge Health that okay, high impact with the use of AI, I'm saying okay, AI can come. It's like first get the infrastructure right here, that people start interacting, exchanging information, asking the right questions, and then comparatively, once you have the context, you can do the. To me, building AI algorithms will not be difficult part. Difficult part is getting people on the platform and getting their information in the right place, in the right format.
Yeah, no, it makes me again think about how you have differentiated where your approach is different from those who have approached electronic healthcare, which is sick care. That's the big focus of electronic health records. How do you deliver sick care primarily? Whereas you're approaching it from truly healthcare perspective and democratizing healthcare. And that's the uniqueness about what you're doing and what Rouge Healthcare is. And again, congratulations on getting started on this in this journey and persisting through. I'm sure it'll bear a lot of dividends. So thank you, Kamal, for talking to us. And with that, we come to an end of another exciting edition of BrainX Talks. For all interested, please over to our LinkedIn page, be part of BrainX community over there. It costs you nothing and adds so much to what you can learn and do with AI. And also our website, brainxai.org, for more information. Everything over there is free. Drop us a line for collaborations. We would love to hear from you. Until next time, stay safe, everyone.